will include authorizing pharmacists to prescribe minor ailments, to initiate and adapt prescriptions, administer vaccines and medications, order and interpret point-of-care tests, and also formally regulate pharmacy technicians within the NWT. And also, as part of this supporting the modernization, will enable electronic prescribing, improving access to naloxone, and introducing definitions for unscheduled substances that may be sold in retail settings. The final approval from Cabinet and the rollout date and timeline has not been shared yet, as it still continues to be under review. As I mentioned in my opening, I attended quite a few meetings, both, like I said, locally and territorially during this quarter. Again, one of them, just some of the examples I've included in my report, are the Indigenous Advisory Body, which is a territorial body that I attend alongside our colleagues at HRHSSA and the Toledo Community Services Agency. That brings representatives from around the NWT, from First Nations and Indigenous governments from across the north. The purpose and the sole purpose of this committee is to get feedback and advice and guidance on how to incorporate Indigenous tradition, culture, and healing practices into the NWT Health and Social Services system. This meeting is held on a quarterly basis, and in December at our meeting we discussed cultural safety and anti-racism. We also discussed a range of topics that include cultural safety and humility standards, integrating youth services, primary health care reform, and child and family services as well. The next scheduled meeting is for the end of March. As well, I've been invited to join GNWT Governance and Service Integration Unit, which is a territorial-wide lead, which is across whole of government and all of the GNWT departments. And this committee really oversees and advances multi-department and whole of government collaboration, and includes guidance and service advice and support for service integration initiatives across the entire GNWT. And so the goal is really to strengthen coordination between GNWT and departments and reduce those silos and those organizational silos that we still experience today in working with our partners. Another group that I've been part of as well is the GNWT Business Continuity Planning Working Group, and also the GNWT Regional Management Subcommittee for the South Slave as well. Those two groups are really very similar to the first group, but the focus is really on business continuity. And the working group the purpose of that is to collaborate system-wide approach to business continuity planning that supports all GNWT boards, directives, boards, departments, and agencies. And it's really a sharing of ideas and talking about challenges and working through those issues as a collaborative. So really pleased to be part of these teams on not just the local level, but also on the regional and territorial level. Also during this time, I wanted to highlight the fact that as part of the collaboration that I'm doing at these tables and having our voice at these tables, we're also having a reach out and working closer together with our territorial partners in health and social services. In the month of November, our senior leadership team did a road trip to meet and discuss with our colleagues challenges and opportunities to our colleagues in Betchco with the Toledo Community Services Agency. I stayed behind for this trip, but the rest of the team went, and I understand it was a great opportunity, like I say, to share ideas and to identify opportunities for us to collaborate further moving forward. And my last update is that we also attended, again, this is working together and doing that outreach. Brian and I attended the HRHSSA Public Administrator Chairs Forum in December. And again, this is a quarterly session, and we also provide, this session provides in-time conversations with the Minister of Health and Social Services to discuss challenges, progress, and recommendations to support stronger programs and services across the territory, and identifies opportunities for collaboration. So as one one health and social services system. So that would be really briefly. That's my update.
Thank you, Erin.
You're welcome.
Next report, the Director of Finance and Administration.
Thank you. So as of December 31st, 2025, the financial results showed a surplus of about $860,000, excluding restricted funding. And the surplus was mainly driven by higher than expected government contributions and investment income, as well as reduced expenses, mainly from lower compensation and maintenance costs. During the quarter, the finance team lost one member, so we are actively recruiting a new payroll officer. In terms of information technology, the team resolved 359 tickets during the quarter, improving response time and user satisfaction. They successfully completed the TSC network and Wi-Fi upgrades with no service disruptions, and they also upgraded the medication and WinRec systems, improving stability and performance. For physical and engineering services, the department hired a casual employee to maintain snow clearing operations and ensuring safe access and facility upkeep during the winter months. And then during the quarter, they successfully installed a new dryer at the health center and completed the Woodland Manor activity room upgrades. For support services, the department took part in Take Our Kids to Work Day, where the team hosted a round of support services Jeopardy to introduce students to topics such as IPAC, food safety, and herbs and spices. The team also showcased incredible creativity and teamwork by winning the Best Group Halloween Costume as an 11-person kitchen condiment ensemble, earning a $200 prize. And then they continued the momentum by securing second place in the Christmas Decorate Your Door Challenge. So that is my update for this quarter.
Thank you. Director of Health Services.
Thanks, Brian. Acute Care this quarter was able to secure 4 full-time indeterminate RN positions, so that's a huge boost to the team going forward. We also have an additional casual person that we've been able to hire. That leaves us with only 2 full-time vacancies and 1 term for the moment. So our clinical operations are in good order within the health center. I would like to mention that we were in receipt of new cardiac monitors, Draeger monitors, which is a great upgrade for staff to be able to use on the inpatient unit and in emergency. In the clinic operations doesn't really indicate a lot in my report at the moment. There'll be a lot more to say at the end of quarter 4, but certainly we've had a lot of process review, and staff have been deeply engaged in all of those processes. Public health has been very busy through the fall. They did their health fair, they continue to do vaccine clinics, and Lori Steinwan was able to do a presentation for KFN on drug-related issues and how the community is coming together around some of that. The fall was a challenging time. October definitely showed a spike in some of drug-related issues within the community. The health authority is working very closely with the town of Hay River on the wellness committee, so we continue to be an active partner with regards to that. As well, I was invited to join the Primary Healthcare Reform Study Tour in the fall. This was a group of individuals from across the different health authorities and different organizations across the territory, and we traveled to different Indigenous-led primary health centers and offices across Alberta and Ontario. So this was a very informative tour for us to be a part of, as we are working closely with our partners in the primary healthcare reform. So that's really the end of my report this quarter, Brian. Thank you.
Thank you. One question on the nurse practitioners in November.
Yep.
In terms of appointments available versus number of clients seen, it's usually generally a wash. I'm just wondering what was different about November.
We had a resignation of one individual in November, and the other individual ended up having to pick up a fair bit of unplanned work that was associated with clinic appointments, unresolved client files that needed to be reviewed, updated, and then basically filed away. So that NP did a lot of that work for us. So she had hundreds of files that she's going through.
Okay, thank you. Next, the Director of Continuing Care.
Thanks, Brian. For Woodland Manor, this quarter was active and engaging and strongly supported by staff and community partners at the Woodland Manor. Regular programming, including exercise, church services, baking, bingo, crafts, outings, pet therapy, and one-on-one visits continued consistently, supporting residents' wellness and engagement. October featured successful seasonal events, including Thanksgiving celebrations, visits from local kindergarten, and Halloween programming. A resident and recreation-led fundraiser raised $800 for future recreation initiatives, highlighting the teamwork and participation. In November, residents took part in Remembrance Day preparations, creating and distributing poppies, and raising $124, which was donated in full to the Hay River Legion. A new weekly program, Art with Kate, was introduced and well received, providing residents with a meaningful creative outlet. Birthday celebrations and core programming continued throughout the month as well. December focused on festive programming and community collaboration. The Fill a Stocking initiative, supported by local businesses and fundraising efforts, ensured all residents received personalized Christmas gifts. Special events including baked and craft activities, community outings, holiday meals, family events, and Christmas celebrations. December fundraising and donations totaling $4,270, with additional in-kind support, including a new recreation room work table donated by Mackenzie Electric. Total funds raised during the quarter was $5,194, reflecting the strong community engagement and meaningful support for resident-focused programming. For supported living services, during the quarter, supported living services delivered a wide range of meaningful programming focused on resident engagement, independence, and community inclusion. Residents participated regularly in social, recreational, and wellness activities that promoted connection, routine, and quality of life. October featured strong community partnerships and seasonal celebrations. A Cat Fae fundraiser held in collaboration with the Hay River Animal Shelter raised $480 to support both organizations and provided an interactive experience for residents and guests. Additional activities include pumpkin carving, a Halloween pizza party, a Thanksgiving supper at the day program, coffee outings to Big Lake, and resident birthday celebrations. In November, programming shifted towards holiday preparation. Residents created handmade Christmas cards for the annual Christmas card fundraiser and contributed to the Festival of Trees with the Grinchmas tree. Participation in the community Santa Parade was a highlight, offering residents a fun and visible role in a local event. Individual shopping trips to Yellowknife began mid-month, supporting personal choice and independence. Staff development was also supported through a departmental meeting that included an educational presentation on schizophrenia. December programming, residents and staff hosted a well-attended resident Christmas party with family and friends, and residents continued individual shopping trips to Yellowknife. A resident-led Christmas card fundraiser raised $2,295, reflecting strong creativity and teamwork. Residents also hosted a community movie screening at the local theater, further strengthening connections with families and long-term care staff. Holiday celebrations included special breakfasts, brunches, and dinners, as well as New Year's Eve festivities. Ongoing outings, wellness activities, and recreational programming continued throughout the month. For our home care services has been continuing on. We are currently down one RN position. One of the challenges we did have during the quarter was the continuation of our diabetes education program. With the absence of the diabetes nurse educator and the dietitian. We did manage to collaborate with the nurse practitioners in primary care to continue those services. And we also continue to engage the former dietitian who continues to support us remotely. And I am happy to say we just had a diabetes nurse educator present for the past month to help us continue with those services. And while we continue to recruit for that position, that person is also going to continue to support us remotely with the program as well.
Thank you, Dale. Our Director of Child, Family, and Community Wellness is away at the moment, but has left some speaking notes with our CEO.
Thank you, Brian. So you'll notice in the report the data regarding the child protection and adult services. So the number of investigations opened declined during quarter 2 and quarter 3. And we believe this decline is attributed to the fact that families who are facing challenges in the height of our community crisis received the much needed attention and were provided the placements in community with family or other resources. We also want to note that there is an increase in adult uptake in this quarter, and the increased area of activity is related to seasonal needs, and the number of support letters of housing and for adult treatment related requests move through our intake process to community counseling programming and increase. They have increased as well. So recognizing that our child and family services team and our community counseling team worked together to support our adult intake numbers increasing during this quarter. The program data for foster care, you'll also notice that recruitment for regular, extended, and family and respite foster homes are critical in the community. We are still short of all of these homes. Right now we have 6 regular foster homes, we have 8 extended or provisional homes, we have 2 respite homes, and we have 0 for emergency homes. The team is working advantageously, and they are working quite hard to find and recruit more foster homes in our community. And they're also looking at special funding required for specialized medical foster home in Hay River as well. Another initiative that our director is looking at is in a form of support to children and families under consideration is possibly of a Cookham House program in the community, which is just right now in the exploratory phase. Youth transition activities are highly focused on outreach, and we'll also note that the youth are waitlisted for services as well, because that continues to increase. The data on the youth transition and family preservation program, the crux of the work associated with these positions is related to outreach activities. It is clearly demonstrated during this quarter in the level of outreach performed. Over quarter 3, it increased to 98 actions or interactions with youth in our community. And we only have 1 youth transition worker in the organization, so there's significant workload increasing. Right now, there's a wait list of 5 clients to access the program as well. For our Healthy Families program, currently our register includes families and active family files and active family member files, individual and family member files. This quarter, we compared those registered to those actively participating in the program, and we're excited to report that most of the registered families are continuing to be active in our programs. During the month of October to December, the Healthy Family program supported 40 families, including 3 prenatal families, through multiple in-person, group-based, and coordinated supports. Programming reached 64 children aged 0 to 6, including children participating through 3-day home providers, each representing aged children. And just to remember, we have only 2 folks in this program as well, so an increase of 64 children. That's just not families, is quite an impact to our program as well. And another need and opportunity that Joanne would like me to bring forward is recognizing we only have 2 folks on staff. The challenge is that this team is supporting and receiving increased request from families with complex needs. So solution, this team obviously really genuinely cares and is responsive to supporting families. So they're trying to adjust their scheduling and their program delivery to stay as flexible as they can, so they can support these families that are reaching out. They're doing the best they can throughout their work week. Some good news stories that Joanne would like me to bring forward is through the Hay River Health and Social Services Authority and the Soaring Eagle Friendship Center hosted a turkey dinner to celebrate Foster Parent Appreciation Month. We had 31 folks attend during this quarter. The Healthy Family staff and the director attended the Foster Parent Appreciation Movie with 18 attendees from the community attending as well. The Foster Parent Appreciation Craft Session was held and to support the Healthy Family staff. We had 5 craft sessions held. Jennifer Buckley was involved as a local stakeholder that taught dream catcher fish scale art, and we had total of 28 participants in all in our outreach craft sessions, which is great. Our community counseling staff were trained in critical incident debriefing during this quarter, and the executive director from the Foster Family Coalition came to Hay River to provide a 1-day fetal alcohol syndrome disorder training for 8 participants, and that was open to all of our foster families as well. Our staff from the Child Protection Services and Community Counseling attended diversity and equity training in Yellowknife, which was sponsored by the union as well. And we have internal staff debriefing sessions facilitated by recently trained community counseling staff to support colleagues due to a sudden death with a team member. And the medical social worker program also reports to Joanne in her directorship. And overall, what they're finding is the most prevalent patient need is through this reporting period is anxiety, and anxiety related to daily living, finances, workplace, or academics, depression, and support and resources. So patients seeking resources outside of Hay River and needing their support. And that is Joanne's report.
Thank you.
Thank you.
Manager, Human Resources.
All right, thank you. So this quarter's been super busy. I think a couple of other reports reported on some of the recruitment efforts that we've done. So we've had 28 hires in quarter 3, and a lot of those were registered nurses for Kim's team, as well as we were very happy to be able to recruit for the manager of community counseling. So that's a win for us as well. We continue to partner with our territorial partners, so Practice NT, so we support and provide our stats to them so they can report on recruitment efforts from a territorial level. We really upped our game with student outreach events, so we hosted Take Our Kids to Work Day in coordination with the territory, as well as we attended the Aurora Research Day again in Yellowknife, so that was super helpful. We had 9 students go through the Take Our Kids to Work Day, as well as we went to a Coley Boreal school and delivered a presentation highlighting the many opportunities that are available within the health authority. So that was great for the team. We assisted the youth transition worker with developing and providing a resume building workshop. So that was during this quarter. You'll see a number of stats. We also put a tree in the festival of trees. So we've done that. This is our 2nd year of doing that. So what we've done is we actually have little QR codes of our job ads. So if anybody walking by wanted to take a picture of our QR, it would take them right to our careers page. So that was helpful. And then we've been providing different learning opportunities in coordination with the Reset and Rebuild groups. So we offered information sessions on the PDI program through the territories, as well as the Targeted Academic Support Program. We had 103 certificates of professional development received and placed on employee files during this quarter. We did 5 removal ins and received, our department's responsible for medical travel, so we processed 69 medical travels. And that's my report.
Thank you. Manager, Quality and Risk.
Thank you, Brian. Always appreciate the opportunity to highlight some of the great work done by the Quality and Risk Department in collaboration with the managers and supervisors as an organizational department. I'll highlight a couple of portfolios, starting with accreditation. So in this particular quarter, we completed step 2 of 5 through the accreditation timeline. So working with teams to complete self-assessments. Self-assessments enable our organization to engage and work together to become more familiar with the assessment criteria. This particular tool helps support continuous improvement and enables the plan and do phases of the Plan, Do, Study, Act cycle. That supports evidence-based learning in an improvement model. So we're successful in that particular aspect. Moving on to enterprise risk management. So our team was able to implement the HRHC risk inventory module, which is an inventory module through the Health Insurance Risk Reciprocal of Canada, which is an insurance company that handles most of the insurance for all hospitals within Canada. So we're very happy to be part of that and have the support of that particular team, tracking the risks and mitigating strategies for the top risks within HRHSSA. Moving through to quality improvement and patient safety. So as part of the quality improvement and patient safety plan, from September to December of 2025, we had the opportunity for our quality improvement coordinator to attend a virtual course through Cascades, which is a course that was designed for individuals committed to environmental sustainability. So the course helps to support future quality improvement initiatives by helping the HRHSSA explore the challenges, opportunities, and leadership capabilities needed to improve change and transform the health sector for long-term sustainability. So we have a couple in our report here, a couple of certificates there that our quality improvement coordinator completed. So kudos for getting the Towards Sustainability Health Certificate to Jordan Bassett. Also in this particular quarter, continuing on with professional development initiative, we were also able to support our quality improvement coordinator to attend the Healthcare Quality Canada Conference. So that was held in Toronto in November, November 20th and 21st. So this particular conference highlights that quality is not just achieved through metrics alone, but it's the product of trust, teamwork, cultural safety, and data-fueled meaningful action. Moving through the report here, for emergency preparedness, our quality and risk team have implemented what we're trying to do is quarterly tabletop exercises. In this particular quarter, we were actually able to get through 2 tabletop exercises. So we focused on Code Green, which is a evacuation tabletop. So working with our territorial partners to ensure that all of our SOP is complete, we were able to go through a tabletop exercise with our team. For Code Green, that took place in October. Moving into November, we actually completed a tabletop exercise for Code Silver, which is an active shooter. So our teams can become more aware of the emergency preparedness exercises and be safe in the event that these aspects happen. We did also have a part to play in advising and communicating regarding our public health advisory. So in this particular quarter, there was a public health advisory on the drinking water. So working with our public administrator, the public health team, they were able to provide us with the information and education to ensure that all staff were aware and get that information out to the public. Moving forward, in our French language services report, I will report out that our French service language coordinator had resigned during this particular time frame and allowed, she wanted to move on to another opportunity, and we were very grateful for her 19 years of service in the particular position and wish her all the best of luck in the future endeavors that she has within the community. So there's some report out on what activities there. It allowed for a deeper view into some of the French language requirements throughout the GNWT, one of which was what's known as the compliance audit. So along with her and our teams, we were able to complete the compliance audit for review through the GNWT and have reviewed through our CEO as well, so that we are meeting compliance throughout the GNWT for French language services. I also will highlight some of the challenges as well. We in this particular quarter we had our infection prevention and control coordinator had moved on to another opportunity as well. So even despite the challenges within our department, we had some folks step up to ensure that we are meeting the demands. We had some great work done through the CPHO's office and ensuring that we do meet the mark in infection prevention and control, so there's no gaps in that particular service. And that's my report for today.
Thank you. First of all, congratulations, Jordan, on your continued commitment to the organization and to lifelong learning. Congratulations. Some time ago, Glenn, you gave me a list of high risk.
Yes, sir.
So since now that we've adopted HRHSSA, and in looking at this graph, because I don't really indicate any numbers, have our risk scenario changed as a result of HRHSSA?
Yes, so the good thing about HRHSSA, so our senior leadership team have had an opportunity to sit down and go through the risks. We have identified that the risks that we do currently have more than likely have already since closed. So there's quite a few risks that we're going to be reducing in our report. The report does indicate all 92 risks that we had indicated in the Folsom report. However, since that time, we've been able to identify some areas of improvement. So we're anticipating that after this particular quarter, this being quarter 3, but the future reports will actually show a much smaller sense of the current risks that we have and really prioritizing on those high risks and adding some proper mitigation strategies.
Okay, thanks. Thank you to the senior leadership team for their reports. Minutes from the last meeting is accompanying this report, and any business arising from the last minutes. Seeing none, Any new business that we have not discussed within the reports or that's not within the reports?
There's a couple things, Brian.
Okay.
If I wouldn't mind.
Yeah.
It's part of this, it's not part of quarter three, but recently, as I mentioned before, part of the Reset and Rebuild initiative, there was a commitment for investment to be made into training. And I just wanted to update you, we're doing the ongoing leadership training to support our supervisors, our managers, and our senior leadership team. In January, we had a 2-day leadership training called Deep Democracy with the facilitator from Ontario that came and trained our team for, I believe it was a 2-day training, and it was a really well-received training, which provided us tools on leadership tools on how to work with our teams, work with our frontline staff, and communications, and tools for difficult conversations, that type of thing. So that was a very successful 2-day training with a commitment to continue that support from our senior leadership team to our managers and our supervisors as a community of practice ongoing, so we can support the implementation and the practice of those tools that they've learned. As I mentioned earlier today, we're on to our second leadership training as part of their journey as well. It's actually called the Lean Refresher Training, which is being led by Dan Florzone, who is also, as we know, is the public administrator for HRHSSA, but also in his life, he's also a trainer. And so we started that training with all of our supervisors, our managers, and our senior leadership team this morning. And that training is going to be ongoing for the next 4 months. So really excited to continue to provide you updates on how we're implementing and testing and developing our ever-growing leadership team in their skills and how we're applying those tools for improvement.
Thank you for that update. So we will be posting, as you will note, when you see this on our Facebook page, the public administrator meetings will be posted with a YouTube link, is that correct?
Yes.
Yes. So as a result of that, the fulsome report will be part of that, as well as this public meeting. And if there are any questions that should arise to that, then we will provide an email to send those questions to and respond back to you. So thank you, team. And do we have a date for the next meeting?
We do not, as of this day. We'll have to work around spring break and vacations. So, yeah.
All right, thank you. Meeting is adjourned.